everybody. I'm Paige McNally, and this is...
I'm Anshua Pal.
And we're a couple of the orthopedic physician assistants who work at our Ortho On Call offices. So we're going to be here today talking about what do we do at Ortho On Call and what we don't do, and answering any questions you guys might have regarding those things.
So Ortho On Call is OrthoVirginia's orthopedic urgent care. We are a walk-in clinic, and so you don't need to make an appointment to come see us, but there is a feature online where you can go and make an appointment, and it'll show up as like TBD on our screen, but not necessary, like I said. You can visit OrthoVirginia.com for more information, and you can look at our locations and all of our different hours. We are open on weekends as well. We try to get you in and out pretty quickly, as fast as we can, but sometimes because it's a walk-in clinic, it does get backed up a little bit, so you might have a little bit of a wait, but overall, I think pretty quick.
Yeah. So we'll just talk a little bit about our backgrounds in orthopedics, and then we'll get into a little more of the details, the nitty-gritty of what we do. So I come from a medical family. My father's an orthopedic surgeon, and my mother is a nurse and did perioperative care, so I always knew I was going to be in the medical field, and it's just a matter of time and figuring out what I wanted to do, and being a PA was kind of the perfect fit for me. And I happened to get into OrthoVirginia for my first job. So prior to coming to Ortho On Call, I worked with one of our total joint specialists and one of our general orthopedists, and did a lot of hip replacements, knee replacements, shoulder replacements, shoulder surgeries, knee surgeries, foot and ankle fracture surgeries, pretty much anything you name it we saw and we did. And then more recently I transitioned here to Ortho On Call to get more into the acute care and to be able to treat people of all ages. So that was my background.
So I also got into orthopedics right out of PA school. Just growing up, I played a lot of sports and injured myself a lot, so saw myself at orthopedic clinics a lot. So I can relate to a lot of patients who come in, athletes, and I just really enjoy treating people like me who got injured back in the day as well. So, you know, I really enjoy treating athletes, even chronic issues like cortisone injections, and trying to just get people back on the field and things like that. That's something that I really do enjoy. So went to PA school at Wake Forest and started up in Northern Virginia at the Fair Oaks and McLean locations, worked in hand and upper extremity, and then now down here doing a little bit more general orthopedics.
I didn't know you went to Wake Forest. That's where I went.
So we went to the same PA school, so that's cool.
We got a lot of Wake Forest grads, I think, that work.
Go Demon Deacons.
Yeah, absolutely. All right, so getting into a little more about what Ortho On Call does, we just, you know, we see, like Anshua was saying, a lot of acute injuries. We do see some acute on chronic injuries, which would mean, like, say you had an ankle injury 10, 15 years ago, and then you fall and re-injure yourself. That would be more of an acute on chronic situation. So we do that. We also see lots of sports injuries, sprains, strains, normal bumps and bruises, that kind of thing. If you fall and feel like, you know, you're having a lot of pain, a lot of swelling, this would be an appropriate place to come. Foot and ankle injuries, shoulder injuries, knee pain and knee injuries. We like to stick to the acute injury when possible and try to get you in with your orthopedic surgeon if it's a more chronic problem as best we can. But obviously we're here for anyone that kind of has an acute issue or acute bone and joint type injury. That's what we specialize in here at this office.
Yeah, two more things that to add on to Paige. Work-related injuries, we will see those as well, workers' comp, and then I believe the Northern Virginia and our Richmond locations will do sports physicals as well.
That's right. Yeah, that's right.
As far as some of the symptoms and conditions that we would probably advise that you go to the emergency room for, you know, you're going to probably get more of a better comprehensive care there for some of these symptoms if you're experiencing them. It would be like chest pain, shortness of breath, especially shortness of breath after like a rib injury. You know, that can definitely indicate like a collapsed lung or pneumothorax is what it's called. Bowel or bladder dysfunction or incontinence episodes that are new. Definitely want to go to the ER for that. Any kind of open fractures, and what that means is it's more of kind of like a complex big bone injury that, you know, the bone is literally kind of sticking out through the skin, or there's a cut that it's exposed to the air. Those are things that need to get washed out. They need to go to the ER, pretty much be seen by a surgeon pretty quickly. And then open surgical wounds that kind of look maybe infectious, or you see a little bit of pus or things like that in it. You know, those are things that you want to get a hold of your surgeon for, or even go to the ER.
Yeah, absolutely.
Yeah.
I mean, there, you know, if you fall and you have a big injury and you look down and your leg looks like it's in a place where it shouldn't be, and you see a bone sticking out, that typically needs for you to go to the emergency room so you can be sedated or taken to the operating room kind of right away. You know, here we would see more like the athlete who's playing soccer rolls their ankle or takes a strong step, here's a pop in the knee and falls. They come in here and we can do a really good evaluation. But anything that's kind of, you know, like Anshua was saying, like an open wound where there's a bone that's visible, the best place for that would be the emergency room for sure. Absolutely.
Some of the in-house things that we have as far as imaging, we do have in-house x-ray, but some of the things that, like, a lot of times people will ask us, do you guys do CT, MRIs? We don't do CT, MRIs, we don't do ultrasound, EMGs. Those are some of the imaging that we can refer you out if it's deemed appropriate at the time or the visit. Or typically, you know, we'll get that follow-up, and, you know, your provider, your physician will order that for you as well.
Absolutely. OrthoVirginia does have MRI machines associated with our practice, and we are able to schedule with our own practice for appropriate patients, and it depends on your insurance a lot of the time, who we can schedule with our own MRI. But that still doesn't mean that we can get people in today, tomorrow. It really depends on the schedule and the availability. So a lot of times, we may have to schedule out, although we try for as many patients as we can to get them scheduled through our MRI, because the process is just a lot smoother for our patients, and that's what we care about at the end. So we have the capability of scheduling with MRI, but again, it's not an instantaneous thing. It's not like you walk in, you know, to the emergency room and they can do everything A to Z. Other things that we can't do here are start IVs, so put, you know, a needle in your arm to give you fluids, give you medications, that kind of thing. We have the ability to do injections, joint injections, some steroid injections, you know, those kinds of procedures, but we're not able to dispense medications like some of our other, I won't say inferior, but maybe not as well practiced in orthopedics, urgent care clinics that we won't have to name now. But we don't dispense medications, but we prescribe medications because we're all nurse practitioners, physician assistants, and we have Dr. Benson, our physician that's with us, that obviously we all have the capabilities of prescribing medications if your condition is deemed appropriate for some type of prescription medication.
So going along with what Paige was saying, some of the procedures that we do include cortisone injections. So a lot of times we'll do cortisone injections for arthritis, tendonitis, bursitis. These are terms you probably will hear us say in clinic and explain. Usually shoulders, elbows, knees. The other procedures that we can do is aspirations, which is drainage of fluid. Usually like knees we'll get, you know, and elbows. But, you know, that it is, the provider does need to kind of, you know, say that that is necessary for your treatment, or sometimes we will refer you guys out for that too, for, you know, with the physicians. So casting, we don't do casting in ortho on call, but we do fiberglass splints, which is very much similar to a cast, but it's a softer version. And that's actually allowed to kind of allow for some swelling after an acute injury. And then we do refer you out to the provider. Typically that you're getting casted over there.
It's a temporary stabilization. Like we want to get whatever is hurt or broken into a stable position, provide the patient with some comfort, and then get them to the appropriate physician who's going to take care of them from there on out.
And then two other things we can think of was basic wound care. So kind of superficial kind of lacerate, or, you know, cuts and wounds that you have, and then like laceration repair. We are capable of doing sutures here, but typically more of the complex ones or deeper ones we'll probably send out.
But we're always willing to evaluate these things. In fact, Last week we had a patient who came in who injured himself at school, and they weren't quite sure whether or not that was something that we could do here. We're happy to take a look at the patient, take a look at the wound, and assess it, and assess that patient, and get them to the right place. And we want to be here to help our patients and get them the most information and get them to the right place as easily as we possibly can.
And Paige did a great job on that suture there, on the laceration.
It was really nice to pull my OR skills back into the office here, because we don't get to do those things all that often.
Yeah.
You know.
But one thing that I will say is that we have a really good system, and like we have great communication with our providers at OrthoVirginia. So if we have any question, if a patient comes in and they are post-op or they need a surgery and we have a question about it, we do get in contact with our OrthoVirginia physicians pretty quickly, because they know that we're taking care of their patients too. And so, you know, just so that you all know that we're not on our own, we have a lot of backup if we need it.
Yeah, absolutely. And on that same note, as far as seeing post-op patients, this is not the preferred place for a post-op patient. The best place to go is to your orthopedic surgeon, and we're more than happy to help direct that care. Occasionally we do have a surgeon, especially like on a weekend case, who would send their patient here for an evaluation, and that's totally fine. We can do that. We love to get that heads up from our surgeons, and most of the time we do. If you ever come here and your complaint is something that you just had surgery on, what we typically try to do first and foremost is triage that at the front desk and see if we can get you in with your surgeon quickly or sooner than your next visit was going to be with them. Yeah. But we definitely are capable of evaluating those things as well. It's just that we want to make sure that your time and money are well spent and that we get you to your surgeon, and again, the most appropriate place. Like we were talking about, you know, urgent care versus emergent care. Right now with COVID, everybody's feeling a little anxious about going to the emergency department, and that's totally understood. We're here to fill that need of these acute sports injuries, and we want to help, again, those patients kind of stay safer and get their treatments a lot faster and in a more appropriate setting. Emergency room care is for life-threatening situations. Open breaks can be that. If a wound is, you know, exposed to bacteria and dirt and that kind of thing, that can be life-threatening. So that's why that would go to emergency room and not come here. Back pain complaints, you know, where you're not able to walk on your own, you're losing function of your bowel and bladder, you're, you know, having a lot of numbness, tingling, weakness in your legs. Obviously we know what's going on, but the best place for that type of patient is the emergency room. And again, coming here first can delay that really important care from happening. So again, when patients call or when they come to the front desk, when we try to get a little information, a lot of times, which is really helpful, our front desk staff will come back and say, hey, this is going on. What do you think? And, you know, most of the time we'll say, bring them back, we'll evaluate them. But sometimes there are situations where we say, get that patient to the emergency room, and we call the emergency room and let their staff know that the patient is coming for sure.
Yep, and just to add on, we do have a lot of DME, so we have, you know, wrist braces, we have short boots, tall boots, ankle lace-ups, we have slings. So a lot of times we will be giving, you know, if it's appropriate in your case or your diagnosis, we will be giving a lot of these kind of braces and splints that to make you more comfortable until that follow-up visit that we schedule you. So
absolutely,
they're just a couple of things that we provide at Ortho on Call.
Absolutely, and there are so many different types of providers coming from backgrounds working with spine specialists, hand specialists like Anshua, foot and ankle specialists, total joint replacement. I mean, luckily for us, we have so many providers from so many backgrounds, and all of that information helps us give our patients the best care we can.
So I think we're going to turn it to some questions that are coming in live.
Hopefully.
I'm going to thank you. That was wonderful. And we do have a bunch of questions coming in. And I'm going to ask, because I'm not mic'd, for you to repeat the question and then answer. What do you mean by acute injury?
Go ahead.
So an acute injury is something that just happened within a few days. I mean, I think in general, when you talk to the providers, we like to see injuries that are like 2 weeks or less old. You know, just happen can be great, If it's looking really swollen, really bruised, in a really funky kind of position, we definitely want to see. There are some injuries that just happen, but we need a little more time to get the best ability to evaluate them, especially with x-rays, because sometimes we don't see things like fractures, which other names for fracture is break, on x-ray for, maybe 10 days or so.
Okay, thank you. Next question is there an age limit to the patients you see?
There is not.
Repeat the question.
Sorry?
Repeat the
Oh,
question.
sorry. Okay, so let me repeat the question. Is there an age limit for the patients that we see here at Ortho On Call? There's no age limit. I'm pretty sure I've seen even a 1 week old for an injury before, and all the way up, so we see elderlies as well, so anywhere in between, no age limit, and we treat them based off their care there. Yep.
So one thing that we just want to say is that we are a walk-in clinic, and so patients are constantly coming in. There are no breaks for us, so if one of us has to step out to see a patient, you might lose one of our beautiful faces for a couple minutes, but we'll be back.
Yeah.
Where are you all in Richmond? I know of your Westbury location. Are there others?
So somebody asked where we are located in Richmond. There are 3 locations in Richmond. There's Westbury, Westchester, which is in Midlothian, and this is our Hanover or Mechanicsville clinic. There are 9 Ortho On Call offices in total. And again, you can go to OrthoVirginia.com and look at our urgent care tab to find all the locations and the addresses.
Mm-hmm. Thank you. Do you guys have surgeons at this location if it's a complex knee issue?
So the question is, do we have surgeons at this location if it's a complex knee issue? We don't have surgeons at our Ortho On Call offices. We do have, obviously, at OrthoVirginia locations, so the closest one to here would be the Hanover at Memorial Regional. We do have physicians and surgeons who are there, and those are typically the offices that we refer to. If it is a complex knee issue, typically we will evaluate you here, and we'll try to do the best care to get you comfortable and get you in the appropriate brace maybe, and maybe prescribe some medications. We will get an x-ray too, and we'll get you that follow-up to maybe the closest or most convenient OrthoVirginia location and surgeon for you.
Yeah, that's one other thing. We do not do surgeries or even, office procedures that you might see done at other offices. For example, some hand surgeons will do carpal tunnel releases in the office. Those are not things that we do here. We don't do surgeries. We do minor procedures, like cleaning up wounds, suturing wounds, injections and aspirations, like we said.
Yeah.
We do not inject any spine, so no cervical spine, thoracic, or lumbar spine. That needs to be done with special x-ray vision, and that's not something we can do at our Ortho On Call locations.
Do I need to bring my own crutches to the appointment?
So somebody asked, do I need to bring my own crutches to the appointment? If you have crutches, that's great. We can fit you for them and make sure that they're appropriate height. Actually, we are experiencing a bit of a shortage on crutches and other medical equipment, like braces and things like that due to COVID and all these issues we've had. So if you've got crutches, or you can borrow crutches or some type of assistive walking device, definitely bring it with you. We'll let you know if you need that, and we'll help fit it to your height.
I recently fell and hit my head. Is this something that I should have come to you all for or gone to the ER like I did?
This is a great question. Great question. So the question is, I recently hit my head. Is this something I should come to you all for or go to the emergency room? Definitely head injuries or head trauma is something that we will pretty much immediately send to the ER. That is because we don't have access to CT here, and the quickest treatment to get is really the emergency room to evaluate for any kind of brain injury, bleed, even concussion, things like that. So head injuries, including motor vehicle accidents, if you are in a motor vehicle accident and you hit your head or lost consciousness or in that short period of time, that is a good indication that you should be going to the ER.
Yeah, and to piggyback off that, I've seen a lot of patients that come in and fall, and they're complaining that maybe their hip hurts or their back hurts. But what we find out when we talk to them, especially for our elderly patients, is that they hit their head, or the fall was not witnessed by somebody else, and they're not sure if they lost consciousness or hit their head. If you witness somebody falling or you yourself fall and you're not sure whether or not you lost consciousness, if you have any type of bruise, cut, scrape, anything like that on your head or your face, you should definitely go to the emergency department. The biggest concern, especially for our elderly patients, a lot of whom are on blood thinning medications, is that there's a bleed happening in their brain. And any unwitnessed falls need a full evaluation. Unless you know 100% you did not hit your head, then I would definitely go to the emergency room to make sure that everything is in check.
Yeah.
Okay, thank you. My wrist is killing me when I type and I can't get through the workday. Is that something to come see you for?
So somebody asked or said, my wrist is killing me and I can't get through the workday. Is that something to come see you for? Yes, absolutely. We can evaluate your wrist pain and treat you appropriately if we feel like you need something like a brace or an oral medication, potentially an injection, depending on what's going on. So sure, we can definitely see you for that. Yeah.
Okay. I have a question about flat feet. Do you all treat flat feet at Ortho On Call?
So the question is, do we treat flat feet at Ortho On Call? So the answer to that would be, I think we would most likely evaluate you. Happy to see you for that. Most likely with flat feet, the mechanics of walking with flat feet can cause other things like tendonitis. There's different conditions that, having that anatomy could cause. And so you can definitely come in, see us at Ortho On Call. We'll definitely do a full exam for you, take some x-rays if needed, and most likely it's also causing something else. So we'll get you the appropriate medical equipment and send you to foot and ankle if we need to.
Definitely. We don't do orthotics or have orthotics here. We don't take measurements for orthotics.
Yeah.
But like Anshua was saying, there are just so many other conditions that can be aggravated by flat feet, and we're happy to evaluate you.
We do also, just to add on, we do write physical therapy orders, and we have a lot of physical therapy clinics in OrthoVirginia associated with each clinic. So if you do get a PT order from us, you can pretty much find a PT location at every OrthoVirginia location.
And occupational therapy as well.
Yeah, and those referrals will include anything from they'll include things like dry needling as well, and even orthotic prescriptions and things like that. So we have the capability of all of that too.
Yeah. One thing also we forgot to mention is things that we're able to do here are schedule with any of our OrthoVirginia providers. It can be a regional, so if you're in the northern part of OrthoVirginia, like practices, they can schedule within those practices. We can schedule within all of our central Richmond providers, and then I forget the other group.
Lynchburg. Virginia Beach, yeah.
Yeah, so we can schedule within our own practice, which is OrthoVirginia. Well, we can't schedule you outside of that, outside of OrthoVirginia.
Okay, thank you. The next question is, I badly stubbed 3 of my toes last week. I'd used ice and kept my foot raised. Should I still get an x-ray because they are still swollen and sensitive?
Is this mine?
Yeah.
Sorry.
Happy answer.
We're trying to go back and forth to share the love. The person asked or said that they badly stubbed their toes, I think a few days ago. It's been bruised, it's been swollen, they've been elevating and icing. Should they come in for an x-ray? This is a great question. Definitely this is an acute injury and you can come in for an x-ray. Like I was saying before, sometimes broken bones don't show up on imaging for 10 to 14 days. I would say if you're pretty comfortable walking around, then having bruising and swelling is not necessarily a precursor for coming in. If you feel like your toes are angled in a funny position or don't look like they normally do, that could be a break that needs to be set in place or reduced, and so that's something we can definitely do here. So I think it all depends on the patient's comfort. I mean, if you're pretty comfortable barefoot or in a regular shoe, I'd probably give it a little while. You can always call our call center and try to get scheduled with one of our orthopedic specialists, either foot and ankle or one of our general orthopedists who see that problem, so that you don't necessarily have to incur the cost of an urgent care facility. So that could be one way to go about it. If you go a few days and you feel like things are getting worse, and that scheduling is out maybe a little bit, for sure, come on in.
Okay, thank you. Next question is, do you have an in-office MRI and ultrasound?
So the question is, do we have an in-office MRI or ultrasound? And we do not. So we went over this a little bit earlier on. The only imaging that we have in-house is X-ray. So we will get those, you know, if we think it is necessary for your diagnosis. But we don't have MRI, we don't have CT scan, we don't have ultrasound, and we don't do EMGs here. Those are usually referrals that we'll send out. You'll have a prescription that we send out, and we'll set you up with an appointment typically.
Perfect. And it looks like the last question is, my child fell on the playground and is limping. I can just bring him in, I don't need an appointment?
So final question is, my child fell on the playground and is limping. I can just bring him in, I don't need an appointment, and the answer is no, you don't need an appointment. You can go to our online scheduling at OrthoVirginia.com and give us a heads up. It's called On My Way, and you're allowed to select kind of a time frame for when you'll be arriving and put a little description as far as what's going on, which is really helpful sometimes. But you certainly don't need to do that. You can come in. We're a walk-in clinic, so you walk in the door, you talk to our front desk staff, and they get you all situated to see us, and then we'll evaluate you.
Okay, that was the last question, so thank you all so much.
All right.
Thank you guys for watching.
Thanks for watching. You know, we'll talk to you another time.